So in the evolution of the research about group work, the research is really just pouring out, showing the effectiveness of group therapy as an effective treatment for a variety of different social issues and mental health issues. But one specific part of the research I want to highlight next is the developing body of information about how neurobiology, especially interpersonal neurobiology, might contribute to our better understanding of the dynamics within groups and the effectiveness of group therapy. So I'm not going to go into a ton of detail in the video about this because it's a really complicated subject. I encourage you to check out the section in this chapter on the book to learn more. Or there's also a chapter in my previous book, Social Work, Sociometry, and Psychodrama, that focuses on neurobiology and group work. Or there's a book called Integrating Interpersonal Neurobiology with Group Psychotherapy, where the entire book is devoted to this topic. So I encourage you to consider checking out some of those other resources. So in that last book I just referenced, the authors Gant and Badenoch have a quote that I thought was important to read to you about neurobiology and group work. They write that understanding the interpersonal nature of brain development and its role in illness, healing, and recovery also helps discriminate how group therapy is different from individual therapy, and in many instances may be a more powerful and logical choice from a brain-based perspective. So what they're saying here is they're highlighting how our brains develop in relationship to other brains, that our brains are really social in nature, that nobody's brain develops in complete isolation, that the circuitry within our brains, the actual structures within our brains, and all of the just the different aspects, different functions of our brain develop through social learning, within the context of relationships, within community, through mirroring, through attachment, and through relationships. And that the nature of our early relationships and attachments, especially with our primary caregivers, has a direct influence on our brain development. When we have secured attachment and healthy relationships with our caregivers and with our community, our brain tends to develop in optimal ways. When we experience neglect, abandonment, trauma, or abuse, ruptures in our attachments with our primary caregivers and our community, it impacts our brain development in ways that are not so helpful throughout our life. And so our brain development, which is based on our relationships in many ways, has a significant role in the development of mental illness, even medical and physical illnesses. It has a significant role in our healing and in our recovery process. And so individual therapy, of course, there's a social and interpersonal nature, an aspect of individual therapy, but that becomes much more pronounced in group work because there's a whole matrix of relationships within the group that perhaps more adequately simulates our experience in a family group and in a community group, which would be more similar to how the social settings looked throughout our early brain development. And so this is one of the main reasons why they're suggesting that from a brain-based perspective, group therapy might be a more powerful and logical choice for healing, for treatment, than individual therapy. And so in this book, they outline 3 primary group therapy components informed by interpersonal neurobiology that might be 3 of the main things to focus on related to neurobiology and group work. The first one we've already been talking about, and this has to do with brain development and memory. And so putting this in the context of trauma, when we experience trauma, especially trauma earlier on in our life, it can really impact not just our mind, but also our brain. And sometimes these traumas impact us at levels below thinking, below cognition, and it can impact our hippocampus's ability to store memory. Many times, traumatic memories get stored more so in the body, in implicit and unconscious ways, than just in the mind and the hippocampus in more explicit and visual memories. And so this is particularly true for relational trauma, complex trauma, and trauma earlier on in our life. And so because trauma gets stored and kind of imprinted on us in our nervous system, in our body, in implicit and unconscious ways, one of the ways of tapping into where the trauma is stored within the body, within the brain, is through experiential, relational, and symbolic ways, rather than just talking. And so the group experience really lends itself to this here and now experience within our body, within the group. That there's ways that we can renegotiate implicit memories within a group setting that we wouldn't be able to do within a one-on-one setting. That there's a different embodied feeling of being in a group than being in a one-to-one setting. And for trauma that we may have experienced within groups, within families, within community, within society, that feeling of being in a group might be essential or important in terms of healing from the ways we've been harmed by other groups. The second area they outline is about the group becoming a holding environment for each individual within the group. That the group essentially becomes a container that can hold all the emotions, the sensations, the feelings, the experiences, the stories experienced by each of the group members. This holding environment is kind of similar to the holding environment that we could create within a one-to-one setting or within a infant and caregiver relationship. That there's this experience of feeling held, of feeling attuned to, of feeling validated, of feeling seen and heard, of feeling felt, that we can cultivate in relationships, and that it happens in a very unique way within a group, that we can create a unique group holding environment for each person. The third primary area that they outline is about neural integration. And they talk about it within different domains, including integration on the level of consciousness, integration on an interpersonal and relational level, integration on a vertical level. And what they mean by that is the different hierarchical aspects of the nervous system and the brain that the group therapy experience helps us to integrate physical sensations within kind of older, lower aspects of the brainstem, within the kind of core central aspects of the brain, older aspects of the brain, with the limbic system, which is a newer, well, it's still old, but a newer kind of middle aspect of the brain. The limbic system has to do with relationships, with feelings, with emotion, with a sense of threat, with anger, with fight and flight responses. The limbic system is something we share with other mammals. And so integrating these two aspects of the brain with the cortex and the prefrontal cortex, having to do with the newer evolutionary aspects of our brain that we don't exactly share in common with other animals. This newer part of the brain that developed, the last part of the brain to develop in an individual's lifespan, but also in the evolutionary span of us as a species, it was the last part of the brain to emerge. And this newer part of the brain has to do with decision making, with rational thought, with a sense of self, with cognition, with future planning. And so when they're talking about vertical integration, they're talking about integrating all these different aspects of our neurobiology. And the fourth aspect of neural integration that they mention is bilateral integration. So this has to do with left to right side of the brain, left and right hemispheres of the brain. So it's important to mention that when we talk about left and right hemispheres of the brain, we're making some pretty big generalizations that are true for many and most people, but not for everybody. Generally speaking, the right hemisphere of the brain has to do with functions related to emotion, sensations, symbolic representation, visual, the senses, seeing, hearing, smelling, feeling. And this is the part of the brain that's very active in brain scans when somebody's remembering a traumatic experience. Whereas the left hemisphere of the brain has to do more so with rational thought, decision-making, cognition, perspective, meaning-making, thoughts, beliefs. And so you can see that these are a bit different in their specialization in terms of different hemispheres. And they actually find that for trauma survivors, folks experiencing PTSD specifically, that the connection and integration between these two parts of the brain are not as connected, not as integrated as somebody that's not experiencing trauma or PTSD. That there's a organ in the brain called the corpus callosum that connects these two hemispheres, and that it gets less blood flow, less activity when we're experiencing PTSD. And so part of the healing process, recovery process, has to involve promoting more bilateral integration to help connect and balance out feeling and thinking states. So these are the three primary group therapy components outlined in this book, Integrating Interpersonal Neurobiology with Group Psychotherapy. Brain development and memory, group as a holding environment for emotions and sensations experienced by the group members, and the neural integration within the different domains of consciousness, interpersonal, vertical, and bilateral neurobiology. So when we think about the group as a whole experience in group therapy, it seems to initiate a right brain to right brain resonance between participants. That there's a way that the feeling of being in a group, the feeling of the group as a whole experience, the feeling of mutual aid and peer support, the feeling of being connected to others in the group provides this implicit, often unconscious, right brain to right brain connection and resonance between participants, which can be particularly healing and powerful. The group context is unique in that there's a multitude of peer relationships within the group experience that are likely to activate, maybe even to trigger, but can contain and help us rework some of these implicit traumatic memories within the nervous system, and that seem to be stored more so in the right hemisphere of the brain. So this is just a simple, or not so simple, overview of neurobiology and group work. If you wanted to read more, I encourage you to check out some of the resources that I mentioned earlier. And I want to challenge you to take a moment to reflect on how can you use some of the neurobiology information that I've provided or that you've learned elsewhere to guide your practice of group work.